Well, you know, we cannot stress this enough, that February is Heart Health Month, and we are on your side with doctors from Baptist Health joining us all month long with some helpful information for you. And right now, we are joined by Dr. Saema Mirza, a cardiologist with Baptist Health and Cardiovascular Associates, to discuss some heart disease. First off, how are you doing?
I'm doing very well. Thank you for asking.
So just in general terms, what is heart disease? What are we talking about there?
So there are several different types of heart disease, but I think what we are here to discuss today is coronary artery disease, when you develop a blockage in your arteries, and if that gets worse, and if it blocks the artery 100%, you can get a heart attack. And that's what we are, I think, going to talk about today when we talk about the risk factors for heart disease.
Yeah, risk factors. When you're talking blockage, you're talking serious stuff there, though, right?
Serious. That's correct.
Yeah. So, are there anything? What happens when that? What causes that type of stuff?
So, there are several different things that can cause it. There are certain things that you inherit or you're born with, such as your gender, your age, your family history, your genetics, ethnicity. That's not in your control. But then there are certain other things such as high cholesterol, high blood pressure, diabetes, your level of activity, your weight, that can influence those arteries, and those are certainly things that you can pay attention to and you can change to improve your heart health. Well,
then how do we change it? How do we improve it? How can we, with those things that you say, that other than things that we have from family history and stuff?
Sure. So most importantly, make sure that you have a yearly checkup with your primary care doctor, and then if not, if they need you to come back sooner, come back sooner. Get your cholesterol checked, get a screening, and if it's high, then you need to work on it, first with diet and exercise, and then if that doesn't work, then with medications. Diabetes, get diabetes ruled out, get your sugar checked. If your sugar is high, then watch your diet, cut back on sugary drinks, processed food, and blood pressure, again, cut back on sodium, cut back on alcohol intake, exercise, lose some weight, and then again, medications. And then your diet and exercise goes a long way.
What kind of symptoms would we notice if we're suffering from this type of issue?
So most of the patients, the classic symptoms are that you walk or you exert yourself, or say you're carrying weight and you feel pressure on your chest, or you feel weight on your chest. Some people feel it like a squeeze, some people feel it like a tightness, some people get pain in their arms, some people feel pain in their jaw. Everyone's different in what they feel. Some people just feel short of breath. And then some people feel like it's just heartburn. But if you are feeling symptoms of heartburn not after eating, but after exerting yourself, that should make you think, is this my heart? And get your heart checked.
Well, and I just real quickly, if we can.
Sure.
Surgery's not always required. Medication can fix it sometimes?
So it depends. If the blockage is not bad, we prefer to treat it with medications, but of course in the setting of a heart attack, then a stent could be life-saving.
There you go. Dr. Saema Mirza, thank you so much for joining us. We want everybody safe out there, and February is a reminder about Healthy Heart Month. Keep that in mind. We're going to have more doctors for the remainder of the month, and we'll see you right after the break with more news here at noon.